It is much easier to perform the handshake technique as shown in the top two images relative to trying to cannulate a haptic into a lumen of a 30 gauge thin-walled needle. The handshake technique typically involves using two microforceps to pass a suture strand from one end of the eye to the other. You don't need to cannulate the suture, you just need to simply grasp it, and you can grasp it in many different areas. And the surface area of the commonly used microforceps is relatively large, and so this technique, as mentioned, is relatively easy to perform. However, when comparing it to the bottom two images, you can see that you have to delicately place the haptic specifically into a lumen of a 30 gauge needle. And so there is less wiggle room in terms of fine movements and in terms of accuracy. This is one of the main reasons why some surgeons stay with techniques that employ a handshake technique, such as, for example, the glued IOL, where you handshake a haptic, but you're not cannulating a haptic, you're just simply grabbing it and externalizing it, or performing acryos fixated IOLs or Invista fixated IOLs, where you're just simply passing sutures across. Whereas with the Yamane technique, it has that steep learning curve of learning how to hold the haptic inside the eye and place it into the needle without at the same time causing any potential damage to the actual haptic.